Watchers chat for January. I've got a slide set to share with everybody, but before we do that, we'll just do a very quick hello around the small virtual room. So I'm Annette, I work for Volunteer Cornwall. I'm a project officer for the climate resilience team supporting primary care in Cornwall, and I cover the west of Cornwall, and then I do the Waste Watchers waste and recycling support across the whole of Cornwall. I will just ask firstly Tim to introduce himself. Hi, Tim.
So I'm Tim. I'm a doctor at the RD&E, but I mostly work with the University of Exeter Medical School, or seconded to the medical school to teach global and planetary health. And I'll pass over to Rebecca.
Hi, I'm Rebecca. I'm newly appointed practice manager at Lostwithiel Surgery, so I just thought I'd pop on and listen what it's all about.
Thanks for joining. Thanks, Rebecca. Spencer, would you like to say hello?
Hi guys, I'm Spencer. I'm the business strategic partner here at Probus.
And Simon, can you just briefly, for the purpose of the recording, say who you are?
Yeah, hi. I'm Simon Rollison from the southeast, so I've not got lost. I'm here deliberately. Regional sustainability team, so looking for any ideas to sort of crack the waste issue.
Thanks, Simon. And I'll ask then, Jo, do you want to introduce yourself?
Yeah, so Jo Taylor, Deputy DIPSI and IPC Consultant Nurse at RCHT and CFT, but from a sustainability point of view, I'm the Deputy Coordinator for the Infection Prevention Society Special Interest Group.
Thank you very much for joining us. It's very lovely to have you. And Lisa, would you like to say hello?
Hi, I'm Lisa Johnson. I'm Head of Infection Prevention and Control at Cornwall and Isles of Scilly ICB.
Wonderful. So now we know who's here. I'm going to crack straight on into the presentation. So we're not going straight into IPC for those for our visitors. Just bear with me. Technology and internet doesn't always work immediately down in the west of Cornwall. Just give me a thumbs up when you can see what I can see. Thanks, Spencer. So today, this is just a very brief run through of what we're going to cover. So we've done our introductions. I'm going to do a brief review of what we did as Waste Watchers in 2025. Going to talk again briefly about waste audits. I'm going to show you where we have our online resources on our new website, because I haven't actually shared that with this group. And then we've got a discussion about sustainability and infection prevention control, which I will ask Jo if she's available to sort of give us an intro and an overview. So that's what we're going to cover today. We've got an hour maximum meeting, so we'll keep going. So I'm not going to read through all of these. This is what we did. We had 5 meetings last year, and I'm pleased to say we covered lots of different topics, and we will revisit some of these again and again, because obviously waste and recycling is one of those topics that it's very broad, but a lot of things are related to each other. So when we're talking about recycling, obviously we quite often will talk about waste audits at the same time. So that's what we covered, and you can find all the recordings on our YouTube channel. Volunteer Cornwall's got a specialist YouTube channel, which I can share with you later on. So first of all, the most audits I did with GP practices was back in 2024. So didn't do quite so many last year, but I'm really keen to do more waste audits with practices that want a helping hand with it. So if you're on the call, or if you're watching this and you're from a practice and you're going, waste audit, sounds good, but not really sure where to start, then do give me a shout. I'm very happy to come and get my gloves on. But basically, it's not that hard. You can get on with it, but sometimes it helps to have somebody visit and do it with you, because it can be one of those things that's easily, oh yeah, I'll do that tomorrow, I'll do that next week. So you literally, quite simply, choose some bins in your organisation. You get the bins, empty them out, have a look at and count what you find. So is it all plastic bottles? Is it actually waste, or is it some food waste that could go in the compost bin? And you sort it all out. there's a waste audit form, which I'll show you later, is available on our website. And then from that form, you can share the results with staff and with patients, but more importantly, you can make some small changes. So a practice that I did this with, we did 2 waste audits in the same practice, and they were about 6 months apart. So to just see the difference, and that was a really nice way to do it. So the first audit that we did, they found about 1/3 of the waste that were in the regular domestic waste bins were could have been recycled or composted. So that was just a simple, okay, so how can we make it easier for people to not put it in the normal bin, put it into the recycling or in the food waste or the compost. So we made those small changes, some new bins in strategic places, reminders, so having a discussion with staff, and then the main thing really is just to encourage, rather than it being, what are you doing putting that in? Nobody's getting told off. It is just making life easier. We all are busy, so it's rushing around. And one thing that I think I haven't encouraged so much, but it's that giving permission for people to have a break, step away from their desk. I know some people are busy answering phones and so on, but if you've got things to put in the recycling bin and it means you walk 2 minutes, round the corner or into another room, then that's okay. It's good to get up and keep moving. I mean, we all work in health, so we all know that sitting and staring at a screen is not very healthy to do for hours on end. So I think that's another angle. It's part of a, it's a well-being thing. Find a reason, make an excuse, i.e. putting your recycling in the bin, to get up and move around. So that's really the main message about waste audits. Not talking about clinical waste at all, obviously, that's a whole other topic. We're talking about all the other waste. Here's a couple of posters. Again, these are available on the website, should you wish to use them. With the simpler recycling guidelines and rules that came in earlier last year, several of you may have chosen to have a food waste recycling collection as well as your recycling and your general waste. But several practices in Cornwall have compost bins. Some have got them recently, some have had them for a long time. So that's another option. And we could, if people are interested, do another one of these sessions talking more about composting if there's the need. But everyone's recycling, so that poster's relevant for everyone really. Now I'm aware that I'm going to switch the order a little bit and just go on to I'm going to come back to our waste and recycling resources. I'm just aware that Lisa and Joe have given up their lunchtime to come and talk. So I'm going to go on to now sustainability and IPC, infection prevention control, for people that haven't come across it. I'm aware that some of the colleagues that will be watching this may be working in community hubs rather than in healthcare, so they might not know all the abbreviations. So we'll have to try and not use all of the abbreviations and acronyms that we use all the time. So I first came across infection prevention control November 2024 when I was invited to join and support the IPC conference, and that's where I met Lisa. So I'm going to pass to you guys. I can stop sharing my screen, but what I have got, just so that you know, I've got the feedback, the ideas board from that conference that I can share with people, and I've broken those down. So if you want, I'll stop sharing for a minute, and then
Lisa, do you want me to just do a very quick overview, and then maybe you want to talk about some of the stuff that Alex and Amy have actually done within the wider community? Is that all right? Yeah.
Yeah.
Okay, brilliant. Okay, so yeah, we obviously wanted to look at sustainability and try to introduce it across all aspects of healthcare. So the conference was a way of us bringing that all together, really, with a way of trying to get everybody who came to that on the day to go away with something they thought they could do. And I think the big thing really was to sort of say to people, it didn't matter what environment you worked in, there was something you could do. So I know that obviously you said, clinical waste is a very different picture. That has a lot of things also within it. But one of the big things we've done within our acute trust more recently around waste is the bigger things. So things like people understanding that if something has a rip in the fabric, that doesn't mean it's an automatic throw it away. There have been people who've done some work on being able to patch those in a way that then means they still can be cleaned. And also, just because it's a piece of furniture that you no longer need, within the organisation here, the facilities team have set up sort of almost like a Facebook page of, we have this, what is this useful to anybody, or is there something you're looking for to ask others? So whereas before it would have just been put out to be collected by the porters and a lot of it would have ended up to go to, waste, there's a lot more reusing and repairing where possible. So I think that's something, especially with the bigger items, that we're trying to encourage at the moment. I think the other thing really is, which is a general theme, is if you can show people this is, yes, you're saving the planet, yes, this is sustainability, but how does it link with everything else? So if you're not buying a new desk, actually that's saving money as well. And we all know that in the healthcare at the moment, that's a massive topic. So if you can show that it's got loads of other benefits, not just, yes, you're saving the planet, you're also going to be saving money, and that also I think helps to get things moved forward, and that's happened with lots of things. So the gloves off campaign, which we've done, the couch roll, do you really need it? We've done quite a lot around when you put waste, it's like how far do you go? We've looked at also like the wastewater, so what are we putting out of our organisation within our cleaning products, and looking at having more cleaning products that are more environmentally friendly but still do meet the requirements to provide the appropriate decontamination within a healthcare setting. So it's sort of looking at lots of different angles, and I think that's what the primary sort of purpose of the conference was to show a few things that we'd done to give people a little bit of a look, here's some ideas for a starter, but actually to get those discussions happening and get people thinking that, okay, the bit they're doing might only be a small bit, but when you add those up in every location and organisation, it can make a big difference. And also about making those links between different people in different organisations so that everybody was learning from each other. So I think that really sort of gives a bit of an overview of what we sort of set out to try to do. And then within the acute and the CFT organisations, we've tried to keep some of that going through the sustainability leads within the organisations, but also through some of our link practitioners. So we did a similar sort of session with our link practitioners to say, look, these go together. They can be interlinked. Infection control quite often is the thing that is given as the reason why you cannot do. Actually, we want to say you can do. And we did a similar thing with them to try and say there's lots of ways that small changes will make a difference and save money. So actually, it ticks two boxes you're being asked to address at the moment. So that's really my overview. But Lisa mostly can give you some more examples of how within the sort of ICB settings and GPs and that some of the work that Amy sort of led on. So over to Lisa.
Yeah. Thank you, Jo. Just before you start, Lisa, I just wanted to say thank you. And also, I'm so glad you mentioned that IPC is quite often, infection prevention control is quite often that, oh no, we can't do that because IPC said, or so-and-so says, and it's, it's given so it's that risk element, which I think is very, very important, obviously in healthcare, that we don't want to risk any spread of infection. So it's the whole permission, what you're allowed to do and what you're not allowed to do, I think comes into this quite a lot. So that's really good. Tim will pick up questions later on if we can. I'll ask Lisa to give some more info from the Cornwall perspective.
Okay, well, I'll try. Just a background, really. I feel like I'm coming around a full circle. It's 40 years this year since I started my training. So I remember receiving bottles back from sterilisation and having to re-vacuum them by hand for people's drains glass bottles, and using elastoplast for cannulas and trying to persuade reluctant people that they needed these special dressings with windows in. So things have changed so much in all of those years. And what we noticed recently is that people are questioning the equipment, and is it wasteful, and should we be throwing this away, which is great. We really support that. And we don't want to be the barrier. We IPC don't want to be the people, that are blamed for all of this overuse of stuff. But we did have a cautionary tale where we detected an incident where coil fitting scissors out of a pack were being reused within a clinic by just being wiped. So it wasn't sufficient decontamination for that product, which looks robust, it looks reusable, and I think that this is the issue, is some things they do look like they should be reusable. And so obviously we've got the cautionary side of what you do need to reuse, what you can reprocess, what you can't reprocess. But we did work, a member of my team worked with local experts and also national experts to help produce a new ANTT protocol for coil fitting that included that information. So, we're trying to feed our learning back into a wider scale. With regard to the conference, it was a really lovely day where we used a marketplace style for people to come round and just throw stickies at us of, well, what do we do about this? And, well, how come that's happening? So I know that Annette's going to share that, but I wanted to sort of pull out of it really just the basics of anybody that wants to start improving the waste in their area, and the big easy things that Joe talked about that you can question. Gloves is always a big one. We definitely picked that up in the conference, and it goes back to training. Again, another blast from the past. I was trained not to wear gloves when changing a stoma bag because it would make the patient feel uncomfortable. Well, we've moved away from that, but now students are being taught to wear gloves to give injections that might not necessarily be appropriate. So it's questioning those things and looking at the latest guidance and coming to us for help. Really, don't write us off. Oh, infection control won't allow that. We may well be able to find a workaround with various things. I know that you talked about tipping up the bins and seeing what's in there. Recycling was a big theme of the conference. Yes, these things have to be used. Yes, we have to have plastic ones, but how come we don't have recycle bins in all of the rooms, the surgery rooms? And it kind of, you could end up with a great big row of recycling bins like I've got in my back garden. But if we're going to do it right, then this is the way that we need to do in our clinical settings as well, and find space for that. So that was part of our conversation. And then things that have become disposable that maybe don't need to be, like curtains, for example. We've got disposable curtains, we throw them away after 6 months or whatever, they've got a little date on the corner. Well, curtains can be washed. The reason we got to disposable curtains is because curtains were never washed, and they were horrendous when you looked at them, and they had all unmentionable splashes up them. But curtains can be washed. So it is questioning all of those things. And I think that when Annette shares the themes of the conversation, maybe some ideas will come out of that for everybody, and definitely come to us and see whether or not we can support ideas, and we should be able to have a decent argument for those ones that we can't. We really think that this does need to be disposable, and this is the reason. And I'll leave it there really. I don't think I've got anything to add. I hope that's helpful.
That's fantastic. I think, Lisa, what will happen is that when I share the comments from, you will be able to chip in and explain the bits that I don't remember or don't understand, because I know we were both there, and there's some stuff that's very specific. So we could, we've got a little while, but this is the thing with recycling, I think, and with waste, is you can go down rabbit holes because you can get stuck on very specific little things that you see being wasted, that you can, why can't it be recycled? And I think it's very easy to get stuck on certain individual items. But I think it's really important to step back quite often and have that overview, like you were saying, We just need to have a little bit of awareness and remember the basics, like you're saying, Lisa. We've had some lovely questions, but I will come back to those if you can bear with us. And I will get on the right slide before I share. So let me share my screen again, get back to my slides. Okay, so there we were. The ideas board, as Lisa said, lots of people came along, wrote notes, talked to us, and we collected all the comments. It was people from across all different areas, so primary care, secondary care, and community nursing. There was loads and loads of comments that were shared. I then went away and rejiggled them, all those comments, and tried to, obviously a lot of them overlap, but tried to organise them a little bit under 3 areas: reuse and recycle, process and logistics, and then behaviour change and education. So I've split them into those 3 groups. So we'll cover them in turn. Please do butt in and ask things if you've got any questions. So bins, we've already talked about bins, not enough bins in the right place at the right time, and the domestic waste bins being underused. So I think people being cautious, worrying about, oh, that might be infected, or, yes, obviously we're very aware that lots of things need to go in clinical waste, but in what I'm learning, speaking to lots of doctors over the years in general practice, is that not a lot of things have to actually go in clinical waste in primary care, in general practice. So domestic waste bins are underused. And if we're talking about cost, the cost of disposing of general waste is much higher than disposing of recycling. So it's about, again, linking back to what Joe was saying about saving money as well. So these things have got all the knock-on effects, and maybe people, we all need reminding, don't we, of that? Oh yeah, it does, makes a difference. More reusable items are needed. There's a whole different list. Joe's already mentioned the curtain, and Lisa mentioned the curtains. So having lots of reusable items is preferred, and there were lots of specifics, people in their different roles saying, well, we could do with some reusable items rather than disposable. Big discussions about equipment that are given to patients and can't be returned, although there was also discussion that in Cornwall we've got the Roach Decontamination Centre, and that items can be returned there. There is a service where you can phone up and request that items are collected. Thank you, Rebecca, thanks for joining. Refilling of items, alcohol pump sprays, for example. So a good news story to end on this: reuse and recycle. So one person shared that they had started recycling or reusing the meal containers on the strike ward. So that was very specific. Lisa, did you want to add anything there on that list, the reuse and recycle list? Anything about the comments from people?
I don't think so. I think you covered really most of what we were saying.
Yeah.
Yeah, no, I think that's okay. I mean, it really comes down to having a question and then deciding whether you need to change completely, whether you need to buy something new that enables reuse or recycling. And sometimes that needs to be a bit of a conversation, but also I feel like we don't receive information around those successes. People are out there doing really good stuff, I think, and I don't know that how much of it is spread around. So feeding back successes, I think, probably would be helpful as well.
Yes, and that reminds me, because this is partly what this Waste Watchers network is all about, is about sharing good news and sharing. And Spencer, who is on the call but is probably busy at the same time, Spencer Casey from Provis, hi Spencer, is shared with us some small changes that they did in there, and that's on a previous recording, because they made some very small changes and replaced items that were being reused. Off the top of my head, I think the one that stuck with me was getting some really nice washable, obviously, china mugs rather than having throwaway paper cups for patients to have drinks in. So that was, for example, that's one thing. So yeah, making those small changes, and you're right, Lisa, we need to be sharing what is the easy wins, and especially I think if you're very local and you're working in a very similar organisation, then just sort of, yeah, literally, well, where did you get that from type conversations are really, really useful. So we'll keep going. The next sort of area is process and logistics. So I won't talk too much about tiger bags because we've talked about that recently. We've had that change. Again, we're talking about reusable ice packs instead of disposable. So again, that's sourcing the right piece of equipment. Metal items put into sharps bins when they could be sterilised, question marks. So again, I think that's your point again, Lisa. People are recognising they're putting something into a sharps bin and they're questioning, and then they need to go and do some research, have a conversation with whoever buys that equipment. Are they designed for being reused and sterilised again, or are they throwaway items? And can we change to a metal item that can be sterilised? So can sterile H2O bottles be recycled? That was in a specific department, so that was another thing that needed checking. Packaging waste is a whole thing as well. Talking about NHS supply chain and going back and questioning whether things can be changed, and whether maybe that needs to be reflected in cost. That if it's less packaging, then that's cheaper, which is encouraging people to choose that option. Specific packs rather than individual items. So this has got, I think, two sides to it. So in some cases, having a specific pack where you know you're going to use the whole sterile things inside that pack, as far as I understand it, being a non-clinician, obviously, is a really good thing because you've got it all there. You're not unwrapping individual items, so that reduces your waste. However, we've had a case in GP practices in Cornwall where the dressings packs were all nicely packed and sterile, but they had far too much than was needed for the particular thing they were trying to do in practice. So that was wasting a lot of things. So it is that swings and roundabouts, like you're saying, choosing the right option for the task in hand, really. A longer return date to procurement, that's a question I haven't really explored, don't really know much about that, to be honest. And then another very specific thing about infusion sets, IV infusion sets. Sorry, clicked too soon. So any comments or questions or thoughts on those sorts of things? I'll move on if nobody shouts, that's fine. And then the biggie, with all of these things, I think when we're talking about sustainability, behaviour change and education is tricky, and we don't want to be the recycling police or the nag that always is saying, well, what are you doing with this, what are you doing with that? It's about I think the education side to it much more than the telling off. So talked about gloves off, lots of mentions at the conference about people recognising and noticing that gloves are used maybe in situations when they don't need to be. Couch roll, you've already mentioned as well, so it's being reduced. Medication waste. So I think I might do a whole topic, a whole one of these Waste Watchers about medication waste, because it spans so many different areas. So I don't want to talk too much about it right now, but just to make people aware that if medication is dispensed and is opened, then that box of medication has to be disposed of. It can't be reused by anybody else. It can't be returned to the dispensary and so on. So that's an important thing. So having smaller boxes, I think that was one point, was smaller amounts of medication in one time, but there's swings and roundabouts about that. So we'll revisit medication waste, but it definitely came up at the conference as a concern. I don't understand that one, I'll be honest. Trial without catheter earlier, use of flip flow, so that's a very specific example. Reducing paperwork, I think that's something that in all aspects of healthcare, and trying to avoid duplication, and no need for daily bed changes. I don't know, again, I don't work in hospitals, but I think that might be an easy change, or it might have already happened. So, and reusable water bottles, maybe encouraging people to use their own water bottles if they are, if there's a planned admission to hospital, or if they're visiting primary care, they'll bring their own water bottle. And can patients wear their own clothes? I think I know the answer to that. I think patients can wear their own clothes in hospital if under general circumstances. I'm sure there are exceptions, but I think that kind of that covers what we did at the conference. So all of those comments came from people working in Cornwall, and it was their comments about sustainability. What came out of it is, what I wanted to also share is the campaigns that have happened in Cornwall, and probably in lots of different areas around the country. So last year we had 2 community pharmacy campaigns. One was Only Order What You Need, and that was also partnered with the Meds Amnesty. Those might be repeated this year. I'm yet to hear if they're coming soon, or the timings of it, but those campaigns reduce medication waste. So that's related to to the comments that were made at the conference. Open the bag, again, it's about opening the bag, checking your medication before you leave the pharmacy or before you leave the hospital, to check that you've got the right medication before it's opened. And waste audits, I've already mentioned. These are ongoing things that are happening in Cornwall. Refractory boxes. Now, I was thinking earlier on, when I think it was Lisa was talking about, recognising that yes, we can't avoid we need to use a lot of stuff in our day-to-day lives, but also in working in healthcare. But can we recycle things? So the refractory boxes are for the very hard to recycle items. So they have specific boxes that are specialist boxes that can be, so this is something to look into if you are really wanting to add an additional, so I'm not talking about the regular recycling that is collected weekly or whatever. This is an additional thing that if you're recognising that a particular task is producing a lot of one item, refractory might be able to provide a box. It isn't free, it does cost, but it's a reasonable fee because it does include the collection and the recycling of it. So if you want to know more about that, get in touch. We ran a pilot in Cornwall a couple of years ago now, where GP practices were issued with these refractory boxes, and they were used and then collected. So we had some funding available for that, and we may be able to repeat that in future. Increased reusables. So we've already talked about sterilisation, and I know that the capacity for sterilisation at Treliske has increased to over 3 million items a year. So it has, for Cornish practitioners, that there's more options. So it's not going to be an issue if you've got more and more things that need sterilising. They can cope at Treliske, which is a good thing. Show Me Your Meds is, you've probably heard of that. It's being trialled in some areas, and again, this relates more to medications waste than the other comments. Yeah, we've seen positive results, that not just about reducing medication, but it picks up lots of other issues. I think a lot of people that have used the Show Me Your Meds have found that it identifies, for example, patients that have got undiagnosed dementia, and they're not taking their medication properly. So there's lots of different things that come out of the Show Me Your Meds. It's not just about reducing medications waste. So it's more of a complex, but really good. It's being trialled in some areas in Cornwall, and we're hoping that might be rolled out later on. So the only one that I know you mentioned that you've done it, Jo, recently, is the Gloves Off campaigns. But I wanted to ask, I I don't know if I think Spencer, I'm just going to have to ask you because there's no other Cornish practices on the call, but I don't know if that's been promoted in Cornwall recently or whether some of our IPC colleagues might be able to say, but Gloves Are Off campaigns, I've seen lots and lots of materials and information for secondary care, for hospital trusts and so on, but not so much for primary. Don't apologise, honey. Thank you for joining us. So yeah, it'd be great to have something maybe specific to Cornwall and specific to the primary care element. What do you guys think?
No, definitely. I
And if
think
there any
that'd be really, really important actually to kind of make it primary care specific. I think there is a huge amount of waste, I think, that goes with gloves and things like that. And I think particularly with us being a training practice, we find it even more. I think there's a nervousness sometimes with some of our trainee GPs, do you mean, when they're early on and when they're not as steady or they're unsure, particularly when they're doing any kind of venipuncture or they're doing things like that. I have seen a lot of our students want to use gloves, but I think that's a hesitancy in terms of their capability in doing that kind of procedure at the start. And I do think as they become more competent, I do see them kind of the step back a little bit more as well. There's also a bit of a cultural thing. I've got to find a lot of more of my Asian background doctors do like to wear gloves. So I don't know if that's something, you know, that has kind of been ingrained in them, that that's what they need to do. But I think some really good solid comms of saying what's acceptable and what's not, I think would be really, really handy, because some of these campaigns have worked really well. We're one of the ones who've been doing Show Me Your Meds. And that's been a huge success. And you're right in that. I mean, it's, you know, it's not just from that massive wastage problem that we've got, which is definitely happening. It's actually improved the healthcare of our patients. And while we've been using Brave AI and while we're working into this INT kind of neighborhood kind of working at the moment, it's really allowed us to actually focus on these patients where we're saying, well, actually, are they using their meds properly? Are they overdue medicine reviews? Can we have the opportunity to realign people's medicines? And I think that's where a lot of the wastage problems come from, is because a lot of people have become out of sync in terms of when they're ordering their medicines. And that's where you get wastage and where people are ticking things or carers are not sure, and you just find that massive build-up. So we have found by doing that and having a robust I suppose patient plan put in place for individual patients now, care plans, and aligning people's medicine so they're only ordering once a month if they can, has really seen a massive reduction in kinds of wastage in terms of that element.
Brilliant, thanks, Spencer. And I've had a comment from Honey saying that you would agree that you agree that Gloves Off in GP truly issued at NHSE would support campaign in primary care. That sounds really interesting. Honey, please put me in touch, with because if it can be national, then it's even more, you know, impact. I was going to say maybe Lisa and I can get our heads together and do a mini Cornwall one, but if we get support from, you know, national level, then let's do the whole, go the whole hog really. So that's really the information about from the conference that we had year before last. Just these pictures, it's just to reinforce really. So these were the posters that we used in the two campaigns. So the Meds Amnesty, these were the posters, and it was about reducing the misuse of drugs and the environmental impact. So trying to avoid people going, oh, I'll just chuck it down the sink or down the toilet because I don't know what to do with it. So it's just reminding people to return their medication if it's not used. Gloves Are Off. This is just a couple of the posters that I just found and just ideas. This one, I think, on the left is more designed for communities, whereas the other one is more general nursing. So I think there's more work. I mean, yes, it's ongoing, but we all need reminding. So maybe we can pick that conversation up outside of this meeting and try and build a campaign. So I'm going to stop sharing my screen again for a moment and just go back to some of those questions because we've skipped over them. So a question from Tim. You can say it yourself if you want to, Tim, but there's a question to say, how did you solve the storage problem for unwanted furniture? It often comes up, and Tim, I'm sure, is not alone because I hear this as well. There's no storage space, so it has to go into a skip. So, Jo, do you have any top tips?
So, yeah, what they've been trying to do, though, is trying to actually say, so the facilities team also manage the portering team. We've got a request to remove this desk from, so it's still in its original location. And therefore, then as soon as that request goes on, they check if it's in a fit state to use and put that out. Would anybody else like a desk? So you miss that middle step. It goes straight from point A to where the next person wants it and completely misses the waste stream completely. So what they then get is, yes, we need a desk. It goes straight from the people getting rid of it to the people who want it. And then we found a lot less actually ends up in the waste stream at all because it's been reused by people who actually want the things. So then only things that are actually damaged and beyond use go out rather than something that's good for someone else to use. And then because now that's been going a while, people now are putting if anybody's getting rid of, I would like. Yeah. So now they're actually asking even before it goes out, so that then people go, oh, I saw, actually, yeah, we're wanting to get rid of that, and they'll reply before they even think to put it out, and say, well, I've got one if you want to organise collecting it. So it's worked that way quite well to actually reduce the amount that's actually been got rid of completely.
Yeah, so that sounds brilliant. Jo, have you got any stats? Have you collected any data on that?
No, I mean, they might have. It's very much been led by the facilities team because they're the ones who've sort of had the portering team who've been asked to take it, who then have to find somewhere to store it until it gets collected. And so it's very much been ran by them. Obviously, initially they came to me and said, do you have an issue with it going, these things being reused? And I was like, no, definitely not. It's a desk or a cabinet or but that has gone to like other things now. A lot of it's found that anything really where people are saying we don't need this anymore, can anyone else use it? And it's just that reusing a lot more. And regarding the ones where before it'd be this wipeable chair has now got a small rip in it, that would have automatically have been it's got to be thrown away out of a clinical setting. You can now get like these reinforced sticky patches that are wipeable. So again, there's quite a lot of work being done around if we can get patches that will stick and not peel up after being on a week, and actually what can we repair instead of throwing out and buying new as well.
Fantastic. That's great. I run sorry, Tim, go on.
I was going to say, yeah, we used to have we had one particular porter who was very, very good at that and saw, was horrified by the waste. I think he's retired now, and he would find somewhere to store things around the trust and things. The problem is in a big organisation, there's a lack of communication because the portering is disconnected from the procurement and the departments don't necessarily
use Facebook, Tim. So you're surprised they don't go through any of the official channels. They've set up a Facebook page, and actually it's used all the time, and everybody uses that. So they just do it through a Facebook page.
That's right. It depends on individuals doing it unofficially.
And of course, so what they'll do is they'll do it. So they still do it through the portering team. They'll say, "I've got," or "Please, can I have?" And they sort of oversee that the messages are going out appropriately, if that makes sense. And it is only being used for like the repurposing of things, not just a general chat page. So
yeah. But of course,
I think it's a great idea. I think it's also I'm also thinking as well, if there are items that can't be found a new home, could there be a way that it's then offered to other organisations? I'm thinking of community organisations. That could be another step to add on to this amazing Facebook page, because we at Volunteer Cornwall, we've got a Facebook page. We could then put that out. You know, does anybody need a, you know, an office chair or equipment that obviously may be substandard for hospital, but obviously could work in a lot of other cases. So yeah, that might be worth. Yeah, if you don't mind asking Jo, whoever it is who's kind of leading on it, to either get in touch with me direct or we'll catch up together on it. I'm really keen because this has come up in the community quite a lot. Yeah, we'll do.
No, I can give them your details, because as I say, most, you know, if it's completely falling apart, that's one thing. But a lot of the time they are things that have got, you know, use in them. And as you say, you know, it's about, and especially, you know, a lot of things at the moment, people are trying to be a lot more careful about what they're spending. The people haven't got the budgets to just go and buy 3 new desks, and, you know, so actually, if you have got to provide a desk and that for people, having that option to get one that's already going at, you know, from someone else has solved quite a lot of problems for people as well.
Yeah, brilliant. I think I'm checking the other questions. And Tim, it was gloves. I think people wearing gloves making hospital beds.
Yeah, and again, that is very much a learned practice, because I think, you know, as Lisa said, when we started nursing, you didn't wear gloves at all to do beds. You know, then everybody wore them because you were told you should wear them in case you're coming into contact with body fluids, you know, and it's very much now about that message. Actually, at home, we don't change our top and bottom sheet every day, do we? So I know most organisations now have gone back to doing a system where they will put a fresh bed for somebody new coming in, but then the top sheet will become the bottom sheet the next day. So instead of changing 2 sheets every day, they're only changing 1, unless it's either soiled or somebody's got a particular like skin condition, or you know, so that it's almost halved the amount of linen that's going out every day, purely by, and you're still getting it changed more than you would at home. You know, and that's the message we've tried to give. You know, we've tried to say, this still means you're getting a lot fresher bed than you would be in your own house. And a lot of that was around patient communication as well, to make sure that people realise because I think sometimes it also goes around making sure the expectation is addressed, not just the staff's, but also your patients. You know, if you're somebody who's been in hospital a few times over the last year, and suddenly somebody's now not putting a clean sheet on the bottom of your bed. So it was around making sure the messages were there as well, to make sure that staff knew why we were doing it and rationale for it, but also so did some of the patients, especially in some of the places where, you know, we might get people who are frequent attenders. So
that's so important, Jo. Yeah, thank you. And Honey, did you want to share this, what you put in the chat, just so that it's recorded? Take it away.
No,
about your
fine.
that's
fine.
I like the phrase that you shared.
Yes, I mean, I would probably change what Trudy says is, if it's wet or sticky and doesn't belong to you, wear gloves, otherwise don't. I mean, I would actually probably slightly change that to, if it's wet and sticky and it belongs to the patient, because actually there are times when we, you know, mop the floor or whatever, it might be wet, but we don't need to wear gloves for that kind of stuff, probably, unless it's a patient, you know, produced thing. If it's coffee or whatever, you don't need to wear gloves, do you? But yeah, Trudy's great in this space. She's really knowledgeable. And I mean, I don't know how much practical support she could give you with the campaign, but she will know what's been done and, you know, have some tips about how to go ahead with it. So I'd be happy to put you in touch if you send me your email address, Annette, and I can, you know, I don't know what her situation is, obviously, with all the changes that are happening with NHSE, but she's always been incredibly supportive with information and you know, just backing us up, really.
Fantastic. Yeah, even if she can just give us some top tips and some pointers, I think that would be fantastic.
Yeah,
so
no problem.
Yeah, this is what I really enjoy about these meetings, is that we always get lots of different people in the virtual room and we share ideas and we learn from each other. So it's fantastic. I like Tim's comment about in the local practice, usually the patients wear gloves, but he thinks that's a heating issue. So I think I would agree, given that we had the storm, didn't we, last week, and I was without heating for a couple of days because we lost our electricity. Then yes, I can relate to that, wearing lots of layers and gloves for that reason. So I'm just checking because we've got a few more minutes. Please do shout out if there's anything else that I've missed in the chat. But I think the only thing I was going to share was the next meeting date is March, second Tuesday in March. Sorry, I thought I had it written in here, but I haven't changed it. So I'll send out an invite for that shortly. And I'm always looking for ideas of topics to cover. And I really, really can't say enough how useful it is to have Joe and Lisa here from IPC. It's so important. I think it's really, really, really useful to have experts in the virtual room. And Lisa, is it okay for people? How should people? You said, "Oh, ask us." If you're not sure, ask us. What's the best way for people in obviously in Cornwall only to reach out to you to kind of check things? What would be the best way, Lisa?
Well, in Cornwall currently, we've got an operational infection prevention and control service dedicated to both primary care and care homes. And I can put the email address for that in the chat.
Fantastic.
There's a caution that might change with the future cluster arrangements with Devon, but currently we have that.
That's brilliant. Thank you. So yeah, if in doubt, ask. And I think unless anyone's got any other comments or questions, I will stop recording and say thank you very much. See you next time.